We've been using the My Health Record now for 6.5 years, and we were one of the early adopters, and it's been a great addition to our business. The My Health Record really helps us engage with our patients by giving us a greater insight into their medical record, particularly their dispensing history. It also allows us conversations with patients that may not be our patients, so they've come from interstate or from other pharmacies. Just the other day I had a patient who wasn't one of our regular patients, and we've been able to jump into her My Health Record. She had some queries about some bowel health issues, and we could see the doctor had prescribed something new, and we were able to see exactly what that was because she had no idea, and we were given some insight by using the My Health Record. The biggest challenge to implementing the My Health Record was around a bit of cultural change in getting dates of birth particularly. Date of birth is part of the key metrics you need to identify an individual patient, so their IHI, their individual health identifier. And part of that was getting that new information that we hadn't previously routinely got. We did get it for some patients, but not routinely. Now it's normal practice for our pharmacy staff to ask patients their date of birth if they haven't been to the pharmacy before, and every patient we identify with an IHI. And either way, whether they have a My Health Record or not, we've got a complete information about the patient. The integration process of My Health Record has been really easy because at the end of the day, it doesn't interfere with your workflow at all. It sits in the background. It's like a friendly clinical companion that sits in the background, and we can use that as needed. The dispense flow automatically goes into the My Health Record, so we don't have to do anything in particular. The biggest change was getting a bit more data about people into their patient profile, so we could identify them with the My Health Record system. So that IHI I was talking about before is critical. We have that information. So that was probably the biggest change of our workflow, going in, making sure those patient records had all the information, and also getting the pharmacists or dispense assistants to actually look on our system to see that those patients have been identified. So we've got a little icon, and if it's green or red, we know that we've identified them. Whether they've got a record or not, we've identified them. If it's greyed out, we know that we're still missing some key metric information, and that's something we've really worked on, training our staff to look for that, look for the box, because if that isn't lit up, then we know we're missing something. Other than that, the workflow has been pretty simple. So the integration of the staff with training has been fairly straightforward. It's really about making them aware that we're using the My Health Record. So any new staff come on, we've included that in our induction checklist. So we actually go through as a point of making it clear that we use My Health Record, what it is and how it works. Particularly for the dispensary staff, that's important, but for all staff, that's important they understand that we're engaged with this process. For the dispensary staff specifically, we show them how the software works and how to access a patient's profile if they're a pharmacist, and an understanding from the technician point of view when they're dispensing that workflow will go into the patient's record. And we've had to work around some of those issues with the software not being quite aligned with the My Health Record in workflow, and there's still some work to be done on that in certain software, legacy software and things like that. But it's really important that staff are aware, and we do go through that when they start in the business. So the pharmacy interns are the same integration process of training them up, like inducting them into the business and explaining we use the My Health Record, where it sits in the software, how to access it, and setting their permissions up. Because of all the security processes, we need to make sure we've identified them with their HPII, which is the health provider identifier for the individual, and that then logs into their dispensing initials, and then they can upload and view patient profiles. So we set that up when they start in the business to make sure they've got access and they understand their responsibilities with access. Information in our dispense software has to be accurate. It's absolutely critical for any system. We're dealing with people's health. So regardless of whether you're on the My Health Record or not, the pharmacy dispense records should be accurate. There's plenty of people with the name Joe Smith, and that's important. We're not uploading the wrong information to the wrong patient. As part of our workflow, when we take scripts in, that's a really important point of checking data. Even though the address is not important for the My Health Record, it is important for us to make sure we've got the right person. It's part of checking. So we check an address, then we check their date of birth, we check their Medicare number, and obviously their name. And when we put that into the dispense system, we can identify whether that accurately reflects what the My Health Record system gets. And that's why those 5 key metrics of information are really important. So that's part of the script intake workflow. From the dispense workflow, it's critical we're checking that that little icon for My Health Record is lit up, regardless of whether the patient's got a record or not, identifying them, as long as they're an Australian citizen with a Medicare card, then we'll have an icon that's lit up for My Health Record one way or the other, and that's a key part of training the staff in the dispensary, that they're looking for that. If they've not got a lit up button, then we've got something missing, and it's critical that we make sure that every time we dispense that information is rectified at the time. In the last 6.5 years, I've had 2 patients who didn't want to give their date of birth. That's out of thousands and thousands and thousands of patients. So ultimately, a patient's in control of the My Health Record, and they're in control of their own record in our pharmacy. If they choose not to give that information, then we have to make a clinical decision: is it safe to dispense for them? And if we choose to, that's fine, we can do that without their date of birth. But I like to explain to the patient why it's important, and if they don't want something up to their My Health Record, or they don't have a My Health Record, it doesn't make a difference. I explain to them it is a medical record. It is important we identify the right patient, because if someone with their same name or similar name comes into the pharmacy, we might end up dispensing it the wrong thing. If we've got a date of birth, we're less likely to have an error occur. So we try and educate those patients around why it's important that we have a proper record. The policy around privacy and security, regardless of the My Health Record, is really important for any business, and particularly in pharmacy. We've got a lot of sensitive information for patients, and they need to have confidence that we have good policies in place, that the patient can trust that the pharmacy is doing the right thing with their information. So when we induct staff, new staff, part of our induction checklist is making sure they understand the importance of confidentiality, privacy and security, making staff aware of general digital hygiene, I like to call it, that they have good practices around what they're doing on the computers and what they're doing with general information is really important. So we want to make sure that the staff are well aware of their obligations. In relation to My Health Record more specifically, we try to ensure that we have a policy that sits within the general privacy policy. The PSA have a great resource called the Digital Health Hub, and that has a template that's been developed with the PSA specifically around the My Health Record, because there is a lot of detail within a general privacy policy that pertains specifically to the My Health Record. We use that template, and I'd probably refer people to that because it's a really good resource. It's absolutely critical that people understand what the My Health Record rules are and who can access and when they can access. It's very important that staff understand that obligation, because it is legislated around access and what consent is, and it's really important that when we train the staff, they understand when it is and when it is not appropriate to access a My Health Record.